My name is Jaila Cruz. I'm currently a student at the University of Puerto Rico Medical Science Campus, coursing my master's degree in Family Nurse Practitioner. Previously, I had completed a bachelor's degree in science and nursing, and I'm a registered nurse. This video is an assignment of marketing the practice from a class of legal aspects. Along this video, I will be explaining what is a nurse practitioner, when did it start, what is the scope of practice, what education you must have to continue these studies, what a nurse practitioner does, what settings may a nurse practitioner work at, and more. In the early 1960s, an increase in specialization in medicine drew many physicians out of primary care, and subsequently led to a shortage of primary care physicians, particularly when government programs in 1965 provided health care coverage for unprivileged patients. Many physicians had already begun collaborating and mentoring nurses with a clinical experience, and nursing leaders believed nurses were qualified to expand their role and fill the need in primary care services. The role of NP, or nurse practitioners, was introduced by 1965 by Loretta C. Ford, a nursing faculty member, and Dr. Henry K. Silver, a pediatrician, in response of the nationwide physician shortage. In 1965, the first nurse practitioner, NP, is developed at the University of Colorado. In 1967, the first master's program for NP started at Boston College. In 1973, the National Association of Pediatrics, NP, is established. In 1974, the American Nurses Association, ANA, developed the Council of Primary Care Nurse Practitioners. 1977, the Pediatric Nursing Certification Board begins a national NP exam. In 1980, three or more organizations are developed: the National Organization of Nurse Practitioner Faculties, National Association of Nurse Practitioner in Reproductive Health, and Nurse Practitioner Associates for Continuing Education. In 1981, the National Conference of Gerontological NPs is started. In 1985, American Academy of Nurse Practitioners is established, and it initiates the development of a national NP database. By 1993, the Association of Women's Health, Obstetrics, and Neonatal Nurses is started. The AANP developed a certification exam. In 1994, the American College of Nurse Practitioners is developed. 1997, all states now recognize NPs. 1998, the AANP becomes the first national foundation for NPs all of specialties. By 2002, the National Task Force revises criteria for evaluation of nurse practitioners programs. The U.S. Department of Health and Human Services, Health Resources and Service Administrations funds the development of nurse practitioner primary care competencies in specialties areas: adult, family, gerontological, pediatric, and women's health. By 2004, AACN releases a position statement proposing doctoral NP education for entry to practice by 2015. In 2005, nurse practitioners celebrate 40 years of practice. What is a nurse practitioner? Is a nurse who performs many duties commonly performed by physicians, often pertaining with patients through the family life cycle. NP offer education and counseling as well as test procedures, often conducting their work autonomously in conventional health clinics or doctor's office. Also known as family nurses, family nurse practitioners are trained to provide a wide range of care to diverse groups of patients. They focus on health promotion and disease prevention, beginning in the childhood and continuing throughout the aging process, and are trained to diagnose and develop treatment plans for acute and chronic diseases. While they are capable of providing specialty care, family nurse practitioners often offer a broad range of services to people of all ages. FNPs may serve as case managers, administrators, patient and staff educators, policy makers, and researchers within the field of family practice medicine. In the United States, because the profession is state regulated, care provided by NP varies widely. Some nurse practitioners work independently of physicians, while in other states, a collaborative agreement with physicians are required for practice. The extent of this collaborative agreement and the role, duties, responsibilities, medical treatments, pharmacologic prescriptions afford an NP to perform and prescribe again varies widely among states of licensure certification practice. The person report provides a current state-by-state breakdown of the specific duties a nurse practitioner may perform in the state. A nurse practitioner role may include the following: diagnosing, treating, evaluating, and managing acute and chronic illness or disease, obtaining medical history and conducting physical examinations, ordering, performing, and interpreting diagnostic studies, prescribing physical therapy and other rehabilitation treatments, prescribing drugs for acute and chronic illness, providing prenatal care and family planning services, providing well child care, including screening and immunizations, providing primary care and specialty care services, health maintenance care for adults, including annual physicals, providing care for patients in acute and critical care settings, performing or assisting in minor surgeries and procedures, counseling and educating patients on health behaviors, self-care skills, and treatment options. NFB, a nurse practitioner with specialty in family medicine. Mostly, family nurse practitioners spend their early years as RN or BSNs. Then they go back to school to earn their master's degree and become an advanced practice nurse, an APN. APNs are specialized nurses with master's or doctorate level training that deliver services that are commonly delivered by physicians. In addition to FNP, there are 3 other titles APNs can earn: certified nurse anesthetist, administer anesthesia to surgery patients; certified nurse midwives, provide prenatal care and deliver babies; clinical specialists, provide basic or specialized care. If you would like to become a family nurse practitioner, you will need a Master's of Science in Nursing degree. Then you must become certified by your state board of nursing or receive a national certification offered by the variety of agencies, including the American Nurses Credentialing Center and the American Academy of Nurse Practitioners. In 2008 of July, 40 organizations endorsed a document, the Consensus Models of APRNs, Regulations, Licensures, Accreditations, Certification, and Education, completed through the work of the APRN Consensus Workgroup and the National Council of States Board of Nursing APRN Advisory Committee. This model outlines 4 roles: certified nurse practitioners, that will be a CNP; certified registered nurse anesthetist, CRNA; certified nurse midwives, CNM; clinical nurse specialties, CNS. Within each role, education is focused on one of 6 population groups. That would be family, individual across the lifespan, adult hematology, pediatrics, neonatal, women's health, gender-related, psych and mental health. Licensure would occur at the level of the chosen role and population group. From there, the advanced practice registered nurse, APRNs, can choose to further specialize their practice, such as oncology, orthopedics, nephrology, palliative care, and others. This recommendation for APRN's regulatory model is targeted to take effect by 2015. The role of a nurse practitioner is very diverse. Nurse practitioners are educated under the nursing model, which is designated to provide holistic and preventive care, engaging the individual as the primary leader in their own care and well-being. Nurse practitioners bring the nursing history of patient advocacy to partner with the individual for mutually agreement upon treatments and optional health outcomes. Nurse practitioners often view the health and wellness of individuals within the family or community system and attempt to incorporate cultural relativism within their treatment and recommendations. NP are advanced practice nurses who provide high-quality healthcare services similar to those of a physician, in primary care and are able to diagnose and treat as a wide range of health problems. Flexibility and autonomy are two of the most treasured characteristics of a family nurse practice. In some states, FNPs have a flexibility to provide services in a variety of settings, which allows them to meet better the specific needs of their patients. Here are some commonly enjoyed work settings. That would be community clinics, health center, urgent care centers, health departments, health maintenance organizations, home health care agency, hospital and hospital clinics, hospice care, nursing practitioner practice or offices, nursing homes, nursing schools, private and public schools, universities and college, physician private medical practice, physician's office, Veterans Administration facilities, retail-based clinic, public health department, school colleges, and walk-in clinics. Some NPs or nurse practitioners could be APRNs. They'll be a BC, Advanced Practice Registered Nurse, Board Certified, CNP, Certified Nurse Practitioner, ACNP, Acute Care Nurse Practitioner Certified, CPNP, Pediatric Nurse Practitioner when certified by a Pediatric Nursing Certification Board, CRNA, Certified Registered Nurse Anesthetist, MSN, Master in Science in Nursing, MN, Master of Nursing, RN, that will be a registered nurse, FAAN, Fellow of the American Academy of Nursing, AAN, FAANP, that would be a Fellow of the American Academy of Nursing Practitioners, AANP, and a DNP, that's a Doctor in Nursing Practice. This profession is in highly demand and looks to be better the healthcare system, educating and working with the patients and taking care of their own conditions, plus promotes a more highly environment and community. At the INM of Puerto Rico, nurse practitioners have had some difficulties in being accepted by the people, community, colleagues, and other professionals of health. This is due to a lack of knowledge of this profession today. There is a law that is being revised and legislated to define this profession, its duties, scope of practice, its limitations, and more. The current nurse practitioners that are in these communities have faith that the law would be in favor for their practice. Some references that were used were allnursingschool.com, Family Nurse Practitioner, midwives.org, worldofnursespractitioner.com, and nplace.org. Thank you for your time.